All right, so this week we're going to be discussing the thyroid, and more specifically Hashimoto's and hypothyroidism, due to them being way more common than hyperthyroidism. We've been seeing a decent amount of cases the past few months and just wanted to share some valuable information that hopefully you can use. We're going to start with a little bit of anatomy first. So everything does start in the brain with our hypothalamus. It'll then send to the pituitary gland, which will then go into the thyroid, where thyroid hormone is made in the version of T4 and T3. Now, the pituitary will always track how much T4 we have in our body, which sends information back up to the hypothalamus, and we have these feedback loops so our body can make an accurate amount of hormones to stay nice and healthy. Now, when it comes to common signs and symptoms of hypothyroidism or Hashimoto's, number one is almost always fatigue. Two, we have decreased brain function. Three, which is another very common one, is a person will complain of signs and symptoms, but nobody will believe them, including their doctor, because their blood work looks normal. Now, why this is important is the longer you go, the more likely you will have an autoimmune disease or Hashimoto's disease. And it's way more challenging to treat in that state than it is in the beginning when you are just complaining of things with normalized blood work. Loss of the outer third of the eyebrow, cold hands and feet, you could have nausea, joint pain, and brittle nails. So those are some of the more common ones. There's definitely others, but that's usually what I'll see. Now, we need to next talk about the top 3 reasons for hypothyroidism or thyroid problems. Number one, by far, is autoimmune disease. So keep in mind, Hashimoto's disease is 90% of hypothyroidism, so we have to always look there first and foremost. Excuse me. 2 is a conversion issue from T4 to T3. So this does not even happen within the thyroid. It happens outside of the thyroid, mainly in the liver and in the gut. So when looking at a person holistically and taking a history and looking at lab exams, it's not enough simply just to look at the thyroid up and just look at thyroid stimulating hormone. You have to look at gut health. You have to consider gut dysbiosis, SIBO, other gut problems. Are you looking at their nutrition? Are you looking at their liver enzymes on a CMP with AST and ALT? Are you looking at cortisol and blood sugar? Are you ruling out a fatty liver disease? These are main reasons for thyroid problems at the root cause level. And the last one is thyroxine binding globulin. Now, this is where there's a problem with the thyroid hormone and it doesn't get connected to the receptors. So those are the top 3 reasons. Now, when it comes to us treating a patient, we will do a full thyroid panel with blood work because, again, thyroid stimulating hormone is not enough. And anytime I've had a patient come in to see us, that is the only thyroid blood work marker that I've ever seen somebody have. It's just a small piece to the puzzle. Now, when it comes to TSH being off, if it's a true thyroid problem, many times I'll see triglyceride issues and total cholesterol issues being off. And if it's more of a pituitary gland issue at the root cause, you're going to see normalized T3 and T4, but T3 reuptake is going to be off and commonly low. Other things we'll look at is T3, T4, what's called free T3 and free T4. These are the active versions of them when they unbind from the carrying protein. We have T3 reuptake, we have reverse T3, and one of the most important ones in my opinion is thyroid peroxidase. Now, this is the enzyme in the thyroid that mainly gets attacked with autoimmune disease or Hashimoto's, and this is also the enzyme that produces T3 and T4. I also find that this becomes off or out of range on blood work way before than thyroid stimulating hormone. So again, if you want to get ahead of the curve, this is why the full panel is important, and especially this TPO or thyroid peroxidase. And then the last one is thyroid globulin antibodies. So when it comes to a holistic approach, we want to do the thyroid panel. Other stuff might be necessary as well, but other things that I'm always looking at is cortisol and hormones like estrogen, and blood sugar, specifically fasting insulin. There's a reason why females are way more commonly getting diagnosed with Hashimoto's and hypothyroid is because they have a lot to do with estrogen and hormones. So if you are looking for a root cause treatment approach to any form of thyroid issue, or if you're concerned that you have a thyroid problem at hand, give us a call. We'd be happy to evaluate you and do some blood work with you.